I have this home one that we use. Sorry, Paul, I might as well get pressure on you anyway. I'm generally not unprepared. Okay. Oh, it's upside down. Dumb head. Sorry, I'm nervous. All right. Sorry, it's going to get even worse. Okay, so we'll give that a minute to run, and I'll continue through with everything else. I don't have a thermometer. I'm sorry. Are you in any pain right now? I'm supposed to assess your pain. Besides that, he does have disc issues, but since he exercises so much, that's how he controls it, and it's been stable for him. So his hands and nails, normal. Good veins, as in any athlete. This hand's going to be red. Look at his nails, and this is so damn tight. So normally they're normal. So what do we got here? All right. We have 142 over 94, which is a little high, but he had a very bad day. So I'll check that later just to make sure it came down. So first we're going to look over his skin. He just has normal hair distribution, just a few red bumps, probably from perspiration because he works out so hard. You don't have any cuts or sores or anything like that, right?
No, it's just bruising.
Oh, what bruise? Oh, yeah. Oh, okay. That was from hockey, right?
Mm-hmm.
Okay. So sorry that his pants are on. He just got home, and my videographer needs to leave. So his scalp, there isn't anything, and unfortunately he doesn't have hair, so this is nice and easy. He had a razor cut here last week, which is gone, that he cut on Easter. First, we're going to test your cranial nerves, so smile. Do it with your with the open mouth. Stick out your tongue. It's midline. Cute nose. Okay, so what I'm going to ask you to do, this is a temporomandibular joint assessment, which I have. So open your mouth. No, go. Do it again. Oh, okay, good. No cracks. In the temporal artery, I don't see it bulging. Oh, I can feel it though. Good pulse. That's why I'm glad I got a healthy person here. And then we're going to press on his sinuses, which might bother him because he's got allergies. Does that hurt? Okay. So that's that. So we're going to do the visual fields. I want you to follow my finger. This way, up, down, side, 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 side. Perfect. And we did that. Visual fields. So his eye structures are normal. There's no discharge, drainage. His eyes are not red. Sorry about the light. I turned them all on. So there's nothing abnormal about his face. I think it's quite handsome. And his pupils are reactive to light. Both of them shrink equally. Whoops, the thing just fell apart. His external ear, does this hurt? Okay, let me put my ear thing back on here. It'd be helpful if this machine worked a little bit better. Okay. Sorry, I'm holding everybody up here. I gotta get this in. Okay, and the light is on. Okay, I'm gonna pull a pin up and back. Sorry, does that hurt?
Nope.
All right, pearly gray, tympanic membrane. No redness, no signs of infection. Pin it up, back. Same on the other side. Pearly gray, no discharge. Takes good care of his ears. Clean your ears, huh? Mm-hmm. So I have to test your hearing. So what I'm going to do is whisper, and you have to tell me if you hear me. Shh. Then they recommend on the sheet that we do the Weber test and the Rhine test, and I do have one of these, but the book says it's not accurate, and it's not a recommended test. So his external nose is fine. Let me look to see if, yeah, no, nothing in there, no bats in the cave. So he's symmetric. And Paul, you did this video with me before, where you remember the 99 thing. So, tactile fremitus. Honey, please, all the animals here. All right, lean forward. So first, sit up a little bit. So take a deep breath. My hands expand normally. Say 99.
99.
Again.
99.
Again.
99.
Perfect. And say it on the front.
99. Fill me up.
Yes, I am. That's right. We have to do a breast exam now that you say that. So I'm gonna. Sorry. So I'm gonna listen to your lung sounds. This I should be good at. Okay, deep breath. Okay, perfect, as I expected, never smoked. Deep breath. Bronchial breath sounds. Again. And while we're at it, we might as well listen to your heart. So sit back. Okay, first I want us to do a Z pattern. Perfect. Okay, stethoscope out. All right. Your normal respirations equal no distress, breathing distress. So we're gonna do range of motion. So I'm gonna move you. Don't move yourself. So 1, 2, up, down. Nothing hurts, right? Okay. Up, up, bend, bend, and bend up. Okay, that's normal too. Kick out your leg. All right, nice and strong. Okay, and then do the other one. All right, we're gonna do lymph node assessment. Let's look up. You think the light's okay?
Mm-hmm.
All right. We're gonna feel our way down. Supraclavicular nodes. I don't feel anything that doesn't belong there, which is good. Might as well throw the thyroid in. Okay, so look up and palpate. Airway is midline. And what I'm going to ask you to do is take a sip of water when I tell you, and the cartilage in your neck should move up and down. Okay, go ahead. Go. Perfect. You want the rest of this? Okay. All right, everybody, we're almost done. I apologize, keeping everybody late. So we did his thyroid, his chest. Sorry. Take a deep breath. I want to make sure you expand normally. You expand normally here. 1 to 2 anteroposterior. Chest. I'm going to do a quick breast exam. I bet no one's ever done one of these on you before. Fortunately, he's very muscular and in shape, so anything that wasn't supposed to be there would stick out. Pardon the pun. Axillary nodes, I'm going to do through his shirt in case your pets smell. No offense. You just worked all day. Okay, nothing that doesn't belong there. So I don't think you have male breast cancer. Jugular venous pulse, we might have already done. But fortunately, we have an athlete here, so everything. He's a hockey player. He just played with the Bruins in Canada. Didn't you, Polly? So we did your heart sounds. Your pulse was in the 60s. Your abdomen is normal. So what I'm going to do is listen to your bowel sounds first, because, where's my stethoscope? Because we can't palpate first because it will interfere with normal bowel sounds. So we're going to listen to all 4 quadrants. Do you eat?
Lunch.
Lunch. And again, normally I would have his shirt off and have him wear shorts, but we're late. He got home from work late. My videographer has to leave. She should have left an hour ago, and I apologize. So, all right, normal bowel sounds. Now I'm going to palpate. I'm going to start with light palpation. Tell me if anything hurts. No?
No.
Okay, now I'm going to do deep. Again, his muscle wall is so stiff and strong that I'm not able to feel the liver because he works out so much. And I'm kind of glad I can't feel the liver. Besides, he doesn't drink. If he did somebody from my family, it would be a different story. All right, so that's good. We did those pulses. I'm gonna, can you kick off at your sneaker? Okay, good. Damn cat. All right. We have a posterior tibial pulse. And we have a strong dorsalis pedis pulse. Sorry about the cat. And then again on the right foot, we have a nice strong dorsalis pedis pulse. So I know everybody has to go, but the last thing I'm going to have you do is just do some walking for me. And the muscle strength test before. Sorry, I screwed up. Hold your arms out. Now, I'm going to push you. Oh, sorry. Actually, hold your hands out like this then. I'm going to push you. Resist me if it's possible. Okay. I'm going to push down. You push back with your shoulders. Okay. Normal strengths. Oh, jeez. Okay. And push down like you're hitting the brake of a car. Perfect. Yeah, your feet are sweaty. So normally I'd assess for an inguinal pulse and some hernias, but I know that you do that all the time. And did you have a hernia before in your past life?
No.
Okay, and that was repaired, right? But it's not an issue?
Not really.
Okay, so this is actually kind of a cool test that, let me see, that I saw in the book. You're going to close your eyes. I'm going to put an object in your hand and you're going to tell me what it is. So close your eyes. What do you think that is?
Coin.
What? Let's see if he gets extra points.
Quarter.
Quarter. Miss Boston accent. It's a quarter. Okay, we're good. So I'm going to ask you to put your finger to your nose like this. Can you do it? Millie! Can you do it with your eyes closed? Okay. Now put your finger to your nose and then do this. Nose and then me with your index finger. Nose, me, nose, me. Do it again. Mel. Oh. Okay. I think it's safe to say that you're neurologically intact. So, the other thing, I'm going to test a reflex on your foot. Do you have ticklish feet? Okay. Ooh. And the toes will go down. There you go. While we're on the topic of reflexes. No, actually, that's wrong. Hold it out like this. Sorry. That hurt? All right. Okay.
Sorry.
I know you're anticipating that it's going to hurt, okay? Dangle this guy. Okay. Perfect. I'm sorry, I'm nervous, I'm not good on camera. So the other thing we need you to do is just walk across the room to make sure that you're steady, which I'm sure you are. So just normally walk. And then walk again. Do this. Put your heel right in front of your foot, like that. Oh, backwards. Wow, he gets extra points. Let's try that again, just so.